Hello everyone, welcome back to this channel. Today I will discuss some of the MCQs on nursing practice. Question number 1. The ability to answer for your actions is known as option A, confidentiality, option B, accountability, option C, advocacy, option D, veracity. So confidentiality, what is confidentiality? Confidentiality means to keep or being able to keep secrets or privacy. Secret or privacy. And accountability means a person is being accountable or responsible. What is advocacy? In nursing, advocacy means like promoting the patient equality or any activities related to ensuring the patient access to healthcare. It is called advocacy in nursing. So veracity means truth telling. So for example, for a patient, suppose patient supposed to get chemotherapy and the patient inquire about the side effects of chemotherapy, so the nurse would be honest about the side effects. They could should tell the patient honestly about the side effects they could expect from the chemotherapy. So here the correct option is accountability, means the ability to answer for the action is known as accountability. Question number 2. The most important stage of the nursing process is option A, evaluation, option B, assessment, option C, planning, option D, implementation. Nursing process, we know nursing process have five stages. First is assessment, second is diagnosis, third is planning, fourth is implementation, and fifth is evaluations. So the question here says, what is the most important stage in the nursing process? The given option is evaluation. What is evaluation? Evaluation is the final step in the nursing process, and in these steps, whenever the healthcare providers intervenes or implements any case, after intervention they should reassess or evaluate to ensure if the desired outcomes has been met or not. So this is the last steps. And what is assessment? Assessment is the first step, as I said, first step of nursing process. In these steps, the nurse involved in critical thinking skills and data collections. Data collection have two types. One is subjective, and another is objective. And then come the third one, it's planning. Planning is the third steps of nursing process. Third step of nursing process. And in this stage, the planning stage is where the goals and the outcomes are formulated, so that the patient care based on whatever the assessment or whatever the diagnosis can be implemented. And then implementation is the fourth step. In implementation steps, this one involve actions or interventions, whatever the after assessment, after the diagnosis, after arriving to diagnosis, then we plan what intervention should we give. Then after planning, then we put it into action or we implement whatever we plan. So in these steps, whatever the it means that the nurse intervene or put or provide care to the patients. So here, what is the important steps? The correct answer is assessment. Is the first steps. With our assessment, if the assessment is not correct or if the assessment is wrong, then the nurse can means the nurse won't get the correct nursing diagnosis for the patients, and she won't be able to provide the care which the patient really needs. Question number 3. The duty to protect privileged information is called option A, ethics, option B, morals, option C, confidentiality, option D, honesty. So ethics, what is ethics? Ethics, they are the moral principles that govern how the persons or group of person will behave on conducts. And morals, they are standard of behavior, we can say principles of right or wrong. And then confidentiality, like I said, it's a state of keeping or being able to keep secret or confidential. Honesty, it's being honest. So the correct option here is confidentiality, means the duty of nurse to protect the privileged information. It's called confidentiality. Question number 4. Informed consent is a method that promotes option A, confidence, option B, justice, option C, autonomy, option D, veracity. First of all, we should know what is informed consent. What is informed consent? Informed consent is like a process of communications between the healthcare providers and the patients or the patient's relatives. That often this communications, it leads to the agreement or permission to provide care or treatment or service to the patient. Suppose a patient supposed to undergo some procedures, maybe or surgery. So the doctors or healthcare providers inform the patient or the relatives, explain the procedures, and then after explaining the procedures, after making the relatives or patients understand about the procedures or the outcomes or the side effects of procedures, then the patients, after understanding all these things, they give their consent in the form of written. That consent is called informed consent. So what this informed consent promotes? It promotes autonomy. What is autonomy means? It is the quality or it's a state of being self-governed. That means the patient decides by himself whether he agree with the procedures or not. Question number 5. To respect a patient's personal space, the nurse, option A, avoids communication, option B, ensures the curtains are pulled around the patient's bed, option C, stands 2 meters away from the bed, option D, explain nursing care and procedures. So the correct option here is option D, which is explains nursing care and procedures. The nurse should always explain any nursing care or any nursing procedure to the patient for patient to cooperate or to respect his or her privacy or personal space. Question number 6. The nurse acts as an advocate in order to, option A, get the point across, option B, offer confidentiality, option C, assess the patient's point of view and be prepared to articulate, option D, abide by the contract of employment. The correct option here is option C, which means to assess the patient's point of view and be prepared to articulate it. Question number 7. A nurse is revising a patient's care plan. Which step of the nursing process is being used? Option A, assessment, option B, planning, option C, implementation, option D, evaluation. The correct option here is implementation. Question number 8. A side effect or a complication of medicine is, option A, drug overdose, option B, drug error, option C, an adverse drug event, option D, a near miss. So the correct option here is option C, which is adverse drug event. So what is drug overdose? Drug overdose is when the patient or when we take more than the normal or the recommended dose of medication, that leads to drug overdose. Option B, drug error. It's sometimes also called medication error. What is medication error? It is a preventable event that may cause or leads the patients to harm or potentially harm the patients. What is near miss? Near miss is an unplanned event that has the potential to cause but does not actually result in human injury. Question number 9. You take a telephone call from the laboratory with critical blood results. You should, option A, ask the laboratory to call back when someone more senior is free, B. Memorize the values and find a senior nurse. Option C. Hand the phone to the healthcare assistant. Option D. Record and read back the result. Repeat the patient's name, hospital number, and date of birth. So the correct option here is option D, which is record and then read back the result. Repeat the patient's name, hospital number, and date of birth. Here, most of the times when there is a critical or emergency sample sent to the lab, usually the lab technicians inform or report the values of the sample through telephones, and in that case the nurse should always note the report values and then reconfirm the patient identity, like suppose the name of the patient, age and sex, the hospital numbers, and then wait for the lab technician to confirm. Then only after the confirmation of the patient identity, then the phone should be hung up. Question number 10. The four spheres of accountability are: option A, care, competence, compassion, confidentiality. Option B, public, profession, patient, employer. Option C, public, person, patient, employer. Option D, public, profession, patient, and police. So the correct option here is option B, which is public, profession, patient, and employer. So in nursing, there are four spheres of accountability in nursing. First is accountability to public, to professions, to patients, and to the nurse employer. Question number 11. The code of professional conduct is: option A, law. Option B, law and guidance. Option C, obligatory. Option D, guidance. The correct option here is option D, which is guidance. So the code of professional conduct is a necessary component of any profession or in nursing professions to maintain the standards or to guide the individuals to adhere to those standards within the nursing professions. Question number 12. The Waterlow Score is an example of: option A, race assessment tool. Option B, nutritional tool. Option C, a tool to work out BMI. Option C, a tool that identifies risk of seizure. The correct option here is option A, which is a risk assessment tool. Waterlow Score, it's a Waterlow Score. It's a tool or it's a risk assessment tool to assess the development of pressure sore or ulcer, or we call it bed sore. It is a scale to assess the development of bed sores. This tool was developed in 1985 by one person named Judy Waterlow. Question number 13. The acronym MUS means: option A, malnutrition universal screening tool. Option B, malnourishment universal screening type. Option C, malnutrition universal scoring tool. Option D, malnutrition anonymous screening tool. So the correct option here is option A, which is malnutrition universal screening tools. So the full form of MUS is malnutrition universal screening tools. It is a tools used to assess or screen the adults or persons who are malnourished or are at risk of malnutrition, and this tool has 5 steps. 5 steps, and is used to screen or identify adults who are malnourished or malnutrition. And these tools can be used in hospital, community, or any other setting or healthcare settings. Question number 14. Patient-centeredness. Option A, focus on the family. Option B is concerned with the person's mental health needs. Option C is concerned with the physical needs of person. Option D is a multi-dimensional concepts. So the correct option here is option D, which is multi-dimensional concepts. Question number 15. Providing nursing care is associated with which aspects of nursing process? Option A, assessment. Option B, planning. Option C, implementation. Option D, evaluations. As I have said, nursing process has 5 steps, and implementation is the stages or the steps which involve in the providing of care to the patients by the nursing personnel. So the correct option here is option C, which is implementation. Question number 16. Which of the following is classified as subjective data? Option A, a patient appears sleepy. Option B, no distress noted. Option C, heart rate is 76 beats per minute. Option D, client says she feels anxious and tense. As I have told you, the data has 2 types. One is subjective and another is objective. What is subjective? Subjective data, it's like verbal statements from the patient. Verbal statement from patient is called subjective data. And objective data are measurable data, such as measurable data such as vital signs, urine output, input output, etc. So here the question asks which of the following is classified as subjective data. So the correct option is option D, because the client says she feels anxious and tense.